Obstetric fistula is a common disease that affects women of young reproductive age in South Sudan. Of every 1,000 births in the country, 2 to 5 women are affected every year. According to the Ministry of Health, it is estimated that up to 6,000 South Sudanese women and girls are living with fistula. The lack of professional midwives in the country, cultural practices that promote early marriage and teenage pregnancy, and lack of adequate treatment put young girls at risk. A high-level delegation led by the National Minister of Health, Dr. Guy Cook, accompanied by the country representatives of the United Nations Population Funds, African Medical and Research Foundation, and World Health Organization visited Western Baragazal State as part of the leadership commitment on the ongoing campaign to tackle fistula. The delegation was received by the governor of Western Baragazal State, Rizik Zakaria Hassan. Dr. Guy Cook said the ministry is working to make South Sudan free from fistula within the next years.
نحن واعيين إنه البرنامج نحن شغالين فيه ده ماشي مع برنامج بتاع رئيس الجمهورية. الفريق سلفا كير ميادي قال أولويات الميزانية في السنة دي البرنامج الأول ده صحة ثم التعليم ثم الطرق. فده تحدي كبير بالنسبة لنا في وزارة الصحة إنه عايزين ننفذ حلم بتاع الرئيس.
Dr. Makur Matur Koryom, the Undersecretary of the Ministry of Health, said the government has taken fistula as a matter of great concern. He said fistula disease can be prevented and asked the citizen to avoid early marriages and pregnancy.
The best way of dealing with fistula is actually by prevention. It is a preventable disease, and it is preventable simply by taking good care of our children, putting them to schools, giving them a chance to learn, gives them a chance to grow until such time when they can decide for themselves to bear children or not. That's one way you can prevent fistula.
On his part, the UNFPA country representative, Dr. Yisa Barnaba, said the partners will work with the Ministry of Health to make South Sudan fistula free. He said the UNFPA will work to restore hope for South Sudanese women affected by fistula.
UNFPA, AMREF, World Food Programme, WHO, UNICEF, and indeed UN Women will continue to support the government of the Republic of South Sudan to achieve its objective in the health sector.
Dr. Winston Kisa, the MREF chief surgeon, said most of the cases are young girls who dropped out from school and that there are patients who lived with the disease for more than 15 years.
Majority of our cases are as a result of obstructed labor, and many of them are not delivering in hospital. For that reason, they get obstructed labor for many days. Many of them have no information that fistula is curable, that fistula is preventable.
Patricia Baptist, a nurse at the WOW Teaching Hospital, recommended that all women should come for regular maternal checkups.
أي مرة بقى حامل لازم يجي مستشفى، يعني لو بيعمل متابعة في المستشفى ما بيحصل له الفستولة. كمان زواج ما يكون زواج بدري، زواج يكون في عمر المناسب.
Monica Lam, a recently operated victim, was happy and encouraged other women not to lose hope and to go to the hospital for treatment.
أنا برسل طبعا في ناس في حياة ما لما حاجة زي يحصل وبيشوف زي فقد حياته خلاص، لكن طبعا تب قاعد يتطور، ده حاجة بسيط بزول لو سوى في حاجة زي يجي مستشفى عشان يلقى علاج.
Since 2006, 300 corrective surgeries have been done in an attempt to clamp down on fistula. The National Ministry is increasing access to fistula treatment and creating awareness among the general public on fistula and its prevention and treatment. For the Niles, I am Simon Bingo.